the lab practical. And this one looks just like a picture in your textbook. So how can you tell on this one which is ventral and which is dorsal? You don't have a vertebra. The ganglion. Remember, dorsal root always has the ganglion, which contains its cell bodies. These are called rootlets, if you have rootlets on your list, and the rootlets are what actually synapse and leave the gray horns. If we look at the horns here, this is the dorsal or posterior horn, the anterior horn, the lateral horn. This is the gray commissure. This is cut so you can see the central canal. This is the anterior median fissure, the posterior median sulcus, the ventral route. This is a spinal nerve. So the spinal nerve contains both the dorsal and the ventral route. I should go back to this one over here because I know you have rami on your list. So as the spinal nerve branches, incoming and outgoing information go to both the posterior and the anterior regions that are served by that particular spinal nerve. So if this is the fifth cervical vertebra, it has some rami that go into the brachial plexus, and the brachial plexus is the group of nerves that innervate the arm. They go under the clavicle and then enter the axillary region and then innervate the arm. So the dorsal rami goes back to the spinal cord, and the muscles and so on that are back behind the spinal region, and the anterior comes around to the front. So this is the anterior part. This is the rami that would come around and go down the brachial plexus, while this one would go back to the vertebral arteries and back in that vicinity. So you've got both a dorsal and a ventral rami. This would be a ventral rami because it's going to the anterior part, and this posterior part would be the dorsal rami.
And what about the rami communicants?
Not a clue.
It says and rami communicants.
Don't know. I need to look.